This series of exercise is basically mobilizing your shoulder in different directions so that your goal is to have a little bit of space between the head of the humerus and the glenoid fossa so that when it moves up and down or it rotates, it doesn't cause you pain. But this one with the belt, usually only the therapists do it because it has to be done with caution. I have taught some of my patients how to do it only because I trusted them to do it correctly. But so I will not be sharing this with everybody on the website. I will send you individual video if I think that you're capable of doing this safely. So I take a belt like that, or you could use any kind of belt, but make a yoga belt or a regular belt, but it needs to have some kind of method of stopping, of not coming out when you shut the door. And I'm going to measure where her shoulder is because your height has to be the same. The shoulder has to be at the same height as this belt is. So I'm going to shut the door like that. Okay, so once I'm comfortable that it's not going to come off, I lock the door. And what I want you to do, the first thing I want you to do is lateral mobilization, so which is basically just moving the head of the humerus away from the glenoid fossa. So I want you to come here, and I'm going to pull it up all the way in her armpit, and I want to make sure that she is, take one step away, yeah, there you go, okay, and the shoulder is relaxed. So what I want her to do is give me your arm, the other hand, and the other arm is going to hold the elbow closer to the body while you just lean on this side. Please do this with caution because I know of people who would do it, yank it, and that's not good because you're actually pulling the shoulder away from the glenoid fossa, okay? And this is used for mostly frozen shoulder people where we have to mobilize their shoulder before you can start doing the exercises. So I want you to go there, and I'm just going to hold it for about 30 seconds, and that's it. You could hold it for 1 minute. All I want you to feel is a gentle pull. It should not be a serious pull. It will be just a gentle pull. So, and holding it for about 30 seconds to 1 minute. Okay. And now, so this was lateral. So we're going to do lateral. You're going to do posterior. If posterior is like this. And you're also going to do anterior, okay? And the reason why I say I want you to do all of these is because certain movements, you have to do a certain type of mobilization, and you probably don't know which one to do where. Unless we do a conference and we do telehealth, and I would be able to look at your range and movements and figure out what kind of mobilization that you need to do. But in this video, I'm going to put all of them, okay? The next one that you're going to do is posterior. So what I'm doing is I'm just moving the strap at the head of her humerus, okay? So it's not here. Do not put it here because it's not going to make any difference. It's at the shoulder level. The clavicle ends here, and it's right after the clavicle ending, okay? So now that the strap is in good position here, I want you to just lean forward, and that will cause the shoulder to move, the head of the shoulder to move back. So, can you lean forward more? There you go. So you're just going to, but don't lean from this side. I want the whole side leaning. And you're going to hold it for about 30 seconds again. And that's good enough. It will just help you not feel the pain when you're doing the exercises in the next video. So this is for your posterior mobilization. I love this for frozen shoulder because if they do this, then they are able to exercise better, and the more they exercise, the better their frozen shoulder gets. Unfortunately, frozen shoulder takes a long time to have a normal movement. So this will at least help to reduce that pain. Okay, so this was posterior. So now we're going to do anterior. So you're going to face the wall, and my strap is again at the head of the humerus, which means it's not at the scapula. I don't want you to put it here because it's not going to make any difference. And your other hand, yeah, you're going to hold it. Okay. Okay, there you go. Just the strap. Okay. Oops, it's not staying. Okay, there you go. Now what I want you to do is I want your whole body going back while your shoulder, it's not done properly. Let's regroup. Yeah, there you go. Might have to put it up a little bit. Okay, go back, and that's okay. I want the alignment of the humerus to be straight. So you're going to keep your arm straight. There you go, perfect. Okay, and you're going to hold it for 30 seconds. So move back as much as you can. You should feel a gentle tug of that humerus, this bone over here, moving forward, the head of the humerus. So it's a great way of mobilizing your shoulder. Almost there. Okay, and that's good. That's 30 seconds. And the last one, so you did lateral, you did posterior, you did anterior. And one other thing that you need to do is you're going to hold a heavy weight. I'm going to go get the weight from the gym. I'm going to hold like a 5 pound or a 3 pound weight on the arm that you're working on, and you just hold it there and let it hang. Don't hike your shoulders or anything, let it hang. And what that does is when it hangs, it actually pushes the head of the humerus down, and that is really good to mobilize the shoulder in certain movements. So now we have increased space between the head of the humerus and the glenoid, and we have also allowed the head of the humerus to move forward, backward, and downward. And this is normally happening in our shoulder. So if you have to lift your arm up all the way, your shoulder actually goes down and then goes up. If it doesn't go down, then it's going to hit the glenoid fossa, thereby restricting movement. So that's about it. And I also would recommend like having a 2 pound weight. I would not use a 5 pound weight in your hand when you go walking, because that will actually cause the inferior mobilization of the shoulder. So that's actually a good thing to do when you have a frozen shoulder. Thank you.